This presentation is about the results of our financial audits of the 16 Hospital and Health Service Entities, or HHSs, for the financial year ending 30 June 2015. Public spending on healthcare consumed more than a quarter of the Queensland budget in 2014-15, with more than $11 billion spent by HHSs. As people are living longer, many are spending more time in their later years with complex medical conditions that require frequent and longer visits to hospital. Diet and lifestyle is also having a major impact on the health of Queenslanders. As a consequence, demand for health services across the state grew by 9.2% over the previous year, but funding only increased by 6.4% over the same period. In this environment, HHSs must closely manage their costs and seek to maximise available revenues. Apart from the executive summary, the report is comprised of 4 main chapters. The context chapter identifies the entities that are subject to our audit, the financial reporting requirements, and our auditing responsibilities. I'll provide a brief summary on each of the other chapters in the report. We issued unmodified audit opinions for all HHSs. This means users can rely upon their financial statements. Financial management at most HHSs continues to improve through timelier reporting and fewer issues raised across the sector, 37% less than last year. HHSs are financially sound and can meet their short-term obligations as they fall due. Given their current strong net asset positions and no debt, HHSs are sustainable over the longer term. As demand for services continue to increase, HHSs need to look at how they can maximise their revenues and obtain great efficiencies from their spend. HHSs rely significantly on state and federal funding, with $10.2 billion received from governments to provide health-related services. Activity-based funding drives the majority of this revenue. While the state has implemented some controls to assure the integrity of activity-based funding data submitted to the Australian Government, these controls are not as robust as they could be. This means the state may not be receiving funding for all the services that HHSs are delivering. All HHSs bar one have a program of internal reviews over the accuracy of coding of their activities. However, only 3 complemented these reviews by obtaining independent assurance through an external review program. The opportunities for HHSs to obtain additional funding from the Australian Government by increasing their level of activity will end on 1 July 2017, when the funding model changes from an activity model to one based on population growth. HHSs are generally managing their costs effectively in providing their services. They met most of their service agreement targets for average length of stay outcomes across 16 diagnosis-related groups. Nationally, Queensland achieved the shortest, or equal shortest, average length of stay in 14 of 20 diagnosis-related groups, and continues to have the lowest reported relative stay index for public hospitals across the nation. Patient access is also improving, with reductions in the number of patients waiting longer than the clinically recommended time for a specialist consultation. There has also been a significant increase in the use of telehealth services. The majority of HHSs receiving activity-based funding in 2014-15 had an average Queensland-weighted activity unit cost below the Queensland efficient price. This means their cost of providing services is equal to or less than the funding they receive for these services. Most were able to reduce their average cost per Queensland weighted activity unit from the prior year. After staff salaries, spending on clinical supplies and drugs are amongst the most significant costs incurred by HHSs. Most HHSs are adequately controlling their spending in these areas, having achieved set targets. An area for improvement for HHSs is in the management of their procurement contracts. Many do not yet have procurement procedures that align with the Queensland procurement policy, and most do not yet have up-to-date contract registers. We identified a number of issues at various HHSs in relation to approving, documenting and managing procurement contracts, as well as an absence of formal evaluation of supply performance when contracts expire. The nature and extent of these issues makes it difficult for HHSs to demonstrate that they have achieved value for money as required by the Queensland procurement policy. Overall, HHSs are financially sound and continue to operate sustainably. Challenges do lie ahead in meeting increasing demand with limited resources.